Okay, well, good morning, grade nines. Yeah, I didn't have much for you last week, just a short lab. But for this week, there's a Google Slides presentation, so I'm going to explain. You don't get to pick from a list this time. You just have to do it. You're all going to be doing the same thing. As I'll explain later, please don't copy off each other. Okay, it's very important. Just do it yourself. It's pretty easy. And there's quite a bit that we're going to get into with this presentation. So it's a bit longer than the last one. So there's a few things to cover. So it'll take you a little more time, but like last week you had way less than 3 hours of work. This week, you'll take a couple hours to do this probably, but this is what we're doing this week. Okay. So like I'd like you to have it like in your folder, say by Sunday if you want. Okay. All right, so, but spread out the work for this one, because if you do it all at once, it will take a couple hours, okay? So if it's going to take full 3 hours, I would do a little bit, say every day, maybe spend a half hour a day, that kind of thing. Sort of take care of one scanning technology every day, and that's it. All right, so the first one we're going to look at here is MRI imaging. So like, the whole point of this presentation, it's all about medical imaging, okay? So there's various types of images. There's ultrasound, MRI, CT scans, and then an older one is called PET scans, and that's an acronym for positron emission technology, okay? But anyway, if you take a look at this, this is an MRI scan. Now these MRI scans, really cool. We call them 2D, like this creates a two-dimensional image, and it's a cross section. And as you can see in an MRI scan, the cool thing about it is you can see soft tissue. So you can see details on the brain, okay, and maybe if the guy's got an issue in his brain, maybe a tumor in there or whatever. You can see here's an ultrasound of someone's knee, or sorry, not an ultrasound, an MRI of someone's knee for identifying problems in the knee. It's a very sensitive scan, which means it picks up lots of details. The human body is not a perfect machine. So even if you, let's say, for example, you feel no pain in your knees and you have no problem that you're aware of, if you took a scan of your knee with an MRI, you might find like some minor problems. But if you're not feeling any pain and if you're not experiencing any problems, then it's not a problem really, okay? So no one just goes and gets these scans for no reason. Usually if you're experiencing problems, then it's time for a scan and they can identify it that way, okay? And the problem with very sensitive scans like this, if you just want to go in and see if you're okay, like if you scan people's back, most people will have, let's say a little bit of herniation in the disc or something like that. But if you're not experiencing any symptoms, so in other words, some people get a herniated disc in their back, like here's an image of someone's spine. People can get these problems like with a herniated disc. Some people will have a herniated disc and not be aware, have no pain, and it's really not a problem. But if you get a scan, you pick it up, then there's something called like psychosomatic pain, where because you know that there might be an issue there, you start feeling pain, like your sort of brain makes you feel the pain, and you weren't experiencing it before. So sometimes ignorance is bliss, and so definitely you would only get a scan like this if it's medically necessary to get a scan. Some of them are quite expensive as well. So that's ultrasounds. I want to show you examples, MRI, I keep saying ultrasound, but these are MRI images. If you just Google ultrasound images, okay, I'm sure like babies and stuff will show up, because typically people get a scan during pregnancy. So here you can see some images of babies. I know when our kids got scanned, you can see soft and hard tissue. The hard tissue shows up as brighter spots, okay, in the ultrasound. But you can also get ultrasounds that look for tumors, okay. The imaging is not as sharp as MRI. It's more fuzzy for sure, but less expensive, okay. That's one of the things you're going to be looking up in the research, is how expensive it is, okay. Now you can see this is someone looking at a pancreas. There's not a lot of contrast in the image. But yeah, anyway, that's ultrasound technology, okay. Now there's more than one kind of ultrasound. So if I Google 3D ultrasound, the 3D ultrasound images, you can see various places in Ottawa. They provide a lot more detail. So here you can see some babies that we're taking using a 3D ultrasound. This is a much higher resolution image. If the babies look scary, to you? Okay. Yeah, well, when you're a developing fetus, sometimes the image looks a little unusual. But anyway, no problem. Maybe you'll find some images online of, babies that actually have problems, because after all, like they're trying to educate you online about what these things can look like and how to look for problems. Okay, but yeah, the babies look a little unusual maybe in these ultrasounds, but 3D ultrasound is a kind of cool way to use a computer and computer imaging to enhance the ultrasound image instead of just getting a cross section. Okay, and finally, there's a Doppler ultrasound. Okay, and I wanted to show you some images of that. So Doppler ultrasounds, they have colors. It's better to show a video of this. Okay, so like you can actually see fluid movements. So you can scan someone's heart and see the valves and movement of the valves and stuff like that. So that's another type of scan. Okay, we'll look up CT scans too. So CT scans, I'm going to do it like this so you can see the machine. CT scans similar to MRI. Okay, so you can see both soft and hard tissue, but it's a different type of technology. Okay, it also produces these cross-sectional views. Here you can see the bones very clearly. Okay, and the guy's back. And you can see the machine and someone going through it. So anyway, scanning technology, that's what it's all about this week. Okay, I've posted the assignment in OneNote. Okay, please look up all the scanning technologies. You don't have to give me a really complicated description of how they work, because some of the physics of how, say, an MRI works is very complicated, but you're in grade 9. I don't expect you to know all that, but here, let's put it this way. Let's say you're a patient and you go into a hospital and you're required to get an MRI, and you say, doctor, can you explain to me, like, is the MRI safe? Like, how does that work? Like, what happens in the MRI? And he'll give you a description that you could understand. And you can find those descriptions online. Okay, so descriptions that are appropriate for grade 9, I leave that to you to find it. You don't need, if you're finding like this overwhelming description of how this technology works, like the spins on the protons and everything else, and what magnetic resonance is, nuclear magnetic resonance, you don't have to give me all of those details. Okay, so please keep it simple. Okay, you're going to include photos, sample images like I've shown you here, videos. You can include all that in these Google Slides presentations. And that's basically it. All right, guys, so have a good week. And if you have any questions, just don't hesitate to ask. But please read the details on OneNote. Okay, read them. Okay, I tried to explain it. I included a rubric also for how it's marked, same as last time. And last time we did a presentation, I mean. So please, like, make sure to read before you ask, okay, questions about it. And then I'd be happy to help if you weren't 100% sure. Also, please try to refrain from asking me to mark it like before I'm supposed to mark it. So you send me your presentation and say, can you go through this whole presentation and make sure it's okay? So I want to get a good mark. I don't want to mark it twice. Okay, so what you can do is you can show it to each other and stuff like that. You can show it to your parents, ask them what they think of it. And if I find there's something missing, I can always send you an email about that. But like the thing is that I can't do that for all 30 people. So like it's one of those things. It's better if you were to just read. Like if you include everything I'm asking for, then you've done it. It's all good. Okay. All right, guys. Have a good week, and we'll talk to you soon.